poll question asked you whether or not you knew that there were 6 classifications of neoplasms when coding, and you all knew that. So let's review. We have primary cancer or malignancy. This is where the cancer originates. We also have secondary cancer or malignancy. This secondary cancer results from the primary, and we call this metastasis, or it has metastasized. Also, we have in situ. This is a form of malignancy, but it's not always malignant. Just to let you know that it can be malignant or it may not be malignant, but this type of malignancy is confined to the site of origin without invading the neighboring tissue, so it's pretty much contained. Also, we have benign. This is not a malignancy, but these are abnormal, non-cancerous cells. We also have uncertain neoplasms. That means the provider can't determine the nature of the neoplasm, so they don't know if it's malignant or not. And finally, unspecified. There's insufficient information in the medical record to assign a specific code. These are the meanings of these classifications. And I just want to kind of drive home a little bit about the nature or the evolution of cancer. So in this represents the prostate, and I'm going to try and show you how cancer evolves. I'm going to try. All right, so the first image represents normal cells found within the prostate gland. The second, this is where you see the normal cells begin to grow and multiply. And these are benign cells. They're not cancerous, so we're going to call them benign. But when those benign cells continue to grow and multiply, and they begin to damage other cells within the prostate gland, and these start becoming classified as malignancy, or they can be malignant, or they are, okay, in this exercise. And this is low-grade malignancy. Now, they become high grade when you have significant structural damage of that gland, and it's caused by these cells becoming aggressive. And look at the mutation. They've mutated into something that could look like a tumor, right? And at this stage, the cancer is aggressive and the patient is really sick. And if that isn't enough, the aggressive cancer cells begin to move to other parts of the body like bone, and this is what we call secondary cancer. Another word for secondary, metastasis, or the cancer has metastasized. So the first two images are benign cells. They're uncertain cells or unspecified cells. The next two represent primary cancer or in situ cancer. And then the last image represents secondary cancer. And I'm finished. And I'm going to let that marinate. Hopefully, it helps you as a coder understand how prostate or how cancer evolves, how normal cells evolve better. Now, let's get to our ICD-10-CM. Let's take a look at it. And let's just observe the columns in the neoplasms table. This neoplasms table is in the index. It's in the alphabetic index. It's after the guidelines. It's after the guidelines right there. And these 6 classifications are found at the top of the table. So the first column, all of the codes within the first column, cancer. All of the second, secondary cancer. And we also call this cancer mets or metastasized or secondary cancer. Then you have your cancer in situ, benign, uncertain, and unspecified behavior. And when your documentation specifies the type of cancer, that's where you get your code. Now let's talk a little more about this neoplasms table. Well, the first thing, all cancers are not coded from this table. Not all cancers, but your malignancies pretty much are. The types of cancers that are not coded using this table are typically your omas, your sarcoma, lipoma. That's not necessarily a cancer, but it could be neoplasma. Also, adenoma, carcinoma. They are not from this chart or table, but where can you find it? Of course, you can find it in the alphabetic index. So you may say, well, don't we go to the alphabetic index first anyway, right? Not for neoplasms. You can go right to the neoplasms table and then verify in the tabular list. I'm going to say it again. You can go right to the neoplasms table, look up your code, then verify it in the tabular list. All right, coders, I'm saying a lot, and I want to know how you're doing. You doing good? People say they're doing great. Okay, another thing I want to tell you about these columns. The first 3 are cancerous. Cancer in situ can be cancerous or not. So we're going to put it in the cancerous section. And the last 3 are not cancerous. They're not considered cancerous. Now, let's go ahead and let's code together using this neoplasms table. All right. A patient arrives to the oncologist to receive treatment for prostate cancer. All right, I got a question. Which cancer are we coding for? Well, it's pretty obvious, right? We only have one cancer, and that's prostate cancer. And this prostate cancer, it defaults to primary. When you're coding for the exam, if there's no mention that this is secondary cancer, the default is primary. All right, so let's go look up this code. All right, so the patient arrived for prostate cancer. So we know this is primary. So our code is we're gonna take our code from the first column, but I do want to point out that these cancers, these neoplasms, are arranged alphabetically. So you just pretty much look for your cancer in alphabetical order. So we're going to go down until we get to the P's and we find prostate cancer. So, CC1, C61, C79, D07, et cetera, But where we find our code, we just make sure we're in the correct column. We know this is primary, so we're going to look in the primary column, and you can see what the answer is. So we've seen that C61 is our code. Let's go ahead and verify. So when we look in the tabular list, C61, malignant neoplasm of prostate. And it tells you to use additional codes, if applicable, to identify the hormone sensitivity status and rising PSA following treatment for malignant neoplasm of prostate. So this isn't applicable. Our documentation was very brief. Therefore, C61 is our answer. And that's how you look up a code. But I think you all know how to use this. At least some of you do, based on your answers. All right. Now you give it a try. A patient was diagnosed with primary cancer of the left bronchus with metastasis to the hip bone. The patient's treatment is for the secondary cancer. All right, this is what you need to do. You have to look up each cancer separately. Okay, coders, type in the chat. What are our two cancers? Good deal. All right, so if you want to, you all are just amazing. If you want to say which one is sequenced first, go right ahead. Okay, I don't want to go too slow. All right, so we have two cancers, the primary cancer of the left bronchus and the metastasis to the hip bone. So we have hip bone cancer as well. Now let's look up the first one. And if you want to write it down, you can just, kind of keep yourself organized on what we're coding. So we're going to look up the cancer, malignant neoplasms of the left bronchus, the primary cancer, right? So first things first, we're going to go to the neoplasms table. Yes, you can start there. And we're going to look under the B's for bronchus. And the column that we look under, it's primary. So the first column is where we'll find our code. So our answer is C34.9. Do we stop there? No. Always verify. Because remember, it gave us C34.9 and there was a dash and a check. So that meant that there were additional codes that you needed to verify for. So when we get to C34.9, we're at malignant neoplasm of unspecified part of the bronchus or lung. Now, which one is applicable? This is the left bronchus. So C34.92 malignant neoplasm of unspecified part of left bronchus or lung. All right, so we got our first code, right? So go ahead and write it down. Write down C34.92. Let's go back so you can see it. Now let's look up our second code, hip bone metastasis. How do you look that up, Mrs. J? Well, let's just call it what it is. It's malignant neoplasms of the bone, right? Which bone? The hip. All right. So you start in your neoplasms table, you look under bone, and underneath bone, you see these are indented slightly. You locate the bone, and it is hip. There you go. And since this is metastasis, this is our secondary cancer. And our code, C79.51. That is our answer. So let's go ahead. Let's look up C79.51. Let's verify it in the tabular list. C79.51, secondary, malignant neoplasm of the bone. And again, secondary means metastasis. All right. How are you doing, coders? Good deal. Someone said, I'm rocking, I'm great, outstanding. All right, so you should have written down your primary cancer of the left bronchus, and you should have written down the code for your hip bone. Now, that's what this is about, guidelines. So we've got our codes, but we don't know which one to sequence first, right? Because we've got two cancers here. Oh, wait a minute. Wait a minute. It says the patient's treatment is for the secondary cancer. So the secondary cancer is being treated. So this treatment of secondary site. Guideline C2.B. And if you look in this third column, it says, hey, you should sequence your secondary or your metastasis first, followed by the primary cancer. Because the success of coding for neoplasms is you always have to think about coding for what is being treated or the RFE. All right. So did everybody understand that guideline? Go ahead, type your answers in the chat. Okay, good deal. A few of you have responded that you do know it. So if you said C79.51 followed by C34.92, outstanding. Now, for today's discussion, we are going to focus on the guidelines. We are. It's imperative that you understand, you know, the definitions and how to apply it. So my advice is to follow along in your MCG manual. You don't have to do it in class, but you can do it if you watch the playback, or you can do it in class too. Flip to ICD-10-CM Chapter 2 in your MCG manual and follow along. We're not going to go in exact order, but you'll be able to find the guidelines because we will number them. Also, if you have an ebook, open it up, type Control F, and then your headings on the left, right here, click it, and then your all of your chapters will populate, and you'll need to click on this one. Specific coding guidelines for Chapter 2, Neoplasms. And I did see someone asking about, how to get to the videos. You get to them from your MCG manual. your TAP videos. Now, let's begin our discussion of the Neoplasm guidelines. All right. So your treatment, and we talked about this, and this is probably what we should have learned. Remember, the treatment directed at malignancy as well as treatment of your secondary site. We're going to focus on those guidelines and more. When your treatment is directed at the malignancy, guideline C2A, that's your first guideline. The cancer being treated will be your RFE, your reason for the encounter, or what you're going to sequence first. Okay? The only exception line is if the patient's receiving chemotherapy, immunotherapy, radiation therapy, or external beam therapy. Okay, so if the encounter is for those reasons, you're going to use the encounter code first, but remember, code the treatment that's directed at the malignancy. All right, guideline C2I1, treatment directed at primary site. Sequence what's being treated first. So if the primary cancer is being treated, cancer. Someone said my mic is going out. One moment. All right. 1 second. Thank you for letting me know. All right, coders. Where did my mic, did a lot of the content go out? Team, did a lot of my content go out? Anything? Please let me know. It's still a little off.
Yes, Mrs. J, it seems dropping at times.
Interesting. Hang on. And this is a new headset. Why did I do this? Okay, testing, 1, 2, 3. It's still dropping. Someone said they can hear me now.
It's good now, Ms. J.
I hope so. Come on, everybody. All right, so we'll figure out why I'm having this problem, but I want to still go through the guidelines. Treatment of the secondary site. Sequence what is being treated. If they're treating secondary cancer, sequence that first, followed by primary cancer. And the only exception to the rule, encounters for radiation therapy, chemotherapy, immunotherapy, etc. Now, I want to give you, I already told you this. This is a tip. It's a good Mrs. J's tip. The treatment be sequenced before. You know, that will be sequenced first. So if the treatment's secondary, that will be sequenced first. So always pay attention to what is being treated. I got another tip. Know the neoplasm categories on site. Yes, typically the lower C's are primary cancer. That's C00 through C76.9. These are primary cancer. And then your upper C's, the C77 through C79.9, that's secondary cancer. Just know that. There are other cancers after C7-9.9, which are primary, but these are the ones that I want you to pay attention to because you'll be able, these are the common codes. These are the common code series that you're going to encounter when you take this exam. Yeah, I said it. Now, I got a challenge. All right. You all ready for a challenge? Okay. Exercise 1. A. C50.321, C79.51B, C50.421, C79.51, C, C79.51, C50.421, and D, C79.21. All right, coders. This is why we say read your answers first, especially for these neoplasms, because if you applied the tips, see those little coins, that's your reminder. So you can just look at this. This is primary, secondary, primary, secondary, secondary, primary, secondary, primary. All right. Somebody put the answer in. I bet she didn't look it up. All right. Thomas has cancer in the lower inner quadrant of his right breast with secondary cancer to the bone. He's being treated for his metastasized cancer. Okay, coders, you don't need any time. You all are rocking and rolling. Keep going. Keep going. I'm enjoying this. Okay, we only got 4 people responding. They stopped. Okay, we got some more coming in. Outstanding. In fact, you should not have to look up too much. Just a little. Just a little. Right. So we're kind of doing this one together. There's no timer here. You'll have a timer on the next one. So I'll show you what I did. Well, first things I'm going to do is highlight my cancer. He has cancer of the lower inner quadrant of the right breast. If you watch the lecture, you'll understand how the breast is divided when it comes to coding. And the patient also has secondary cancer to the bone, and he's being treated for metastasized cancer. Yeah, so men do get breast cancer, if you were wondering. Now, I'm going to go look at that same guideline, C2B, treatment of secondary cancer. If you want to follow along with the guidelines in your MCG manual, please do so. So we are told to sequence your secondary first, followed by the primary. So on site, we can eliminate 2 answers. Which 2 can we eliminate, coders? Yes, on site, we can eliminate A and B, right? How can we eliminate those, Mrs. J? Based upon that tip I just gave you, the lower C's are under C79, whatever I said it was, the lower C, and the upper C is typically secondary. So the lower C is primary and the upper C is secondary. And if this patient is being treated for metastasized or secondary cancer, then we need to be sequencing that secondary cancer first. And A and B are not. They're sequencing the primary first. I just feel like I'm beating a dead horse because I think you all get this. Well, you act like it. Outstanding. All right, so that leaves us with C and D. And you know what? You don't have to look that up in the book. You can cross those out right away. And if you can, you've just saved time on your exam. Now, let's go ahead and let's finish coding this out. C50.32. The C50.421. Okay, so C50.321 is the code for malignant neoplasm of lower inner quadrant of the right male breast. Okay, those are our key words. It's matching it up just right. Lower inner quadrant, right breast. And Thomas, I'm going to assume, is a male. And C50.421, malignant neoplasm of upper outer quadrant of right male breast. So it is that specific, and you should pay attention, be very forensic to pay attention to make sure that you're coding for the correct portion of the breast. So we're already have eliminated, oh my goodness, I'm out of order. We eliminated A and B. Now, let's go ahead to C79.51. This is correct for secondary malignant neoplasm of the bone, secondary cancer of the bone. And there's our guideline. We have to sequence the secondary first. And D is our answer. All right, coders. How are you? Good deal. Good deal. Good deal. All right. Now we got another one. We're in a rhythm. Let's do it. You guys make this look easy peasy, lemon squeezy. All right, see my little tip down there? Don't forget the tip, okay? Of the following, which best describes the encounter? A, C79.51, C50.919, B, Z08, C50.919, C79.51, C, C50.919, C79.51, D, C08, C79.51, C50.919. Alexis arrives at the oncologist's office for 6 months review of her breast cancer treatments. During the encounter, it was discovered that the cancer had spread to her vertebrae. The oncologist adjusted her therapy regimen to include the secondary cancer. Of the following, which best describes the encounter? Okay, coders, you're going to need some time. So your time begins. I think you have 2 minutes to solve. Your time begins now. How are you doing? I can't move. I can't see the chat while you're working. So, wow, this is good. This is good. I like it. I like it. All right. So, someone said they're confused. Not for. Okay. All right. So, let's go ahead and determine cancers. We have breast cancer. This patient's in here for a 6-month review of her breast cancer treatments. And it's been determined during that encounter that the cancer has spread to her vertebrae. And the oncologist pretty much just adjusted the existing therapy. And you know what? Somebody said, hey, I'm confused, and you should be, because we don't know which cancer was treated, right? We don't know which one. We don't know. We don't know which one was where the treatment was directed, but there is a guideline that helps us. All right, so if you look at the same guideline, C2.A, treatment at the malignancy site, below, it says when a patient has both primary and secondary cancer, but the documentation does not specify the reason for the encounter. It's not real clear, but then again, maybe it is. They were discussing her breast cancer. I don't know. But if you have a circumstance where you can't tell, your primary cancer will be the default. So when you can't tell or you don't know, primary is your default. So that one will supersede the secondary. Primary will supersede the secondary. So with that said, we can eliminate some things, right? On site. Go ahead, coders, type in the chat. Yeah. Yeah. Uh-huh. Somebody said A, B, and D. Well, just based upon this guideline, we can eliminate A and D. The secondary cancer, we know this is secondary, C79 secondary, right? Right? And B and C are sequencing the primary before the secondary. Okay? I'm going to let that marinade. You all with me? I really want to know if you're with me, because cool beans. I need to know that you're with me or not, because I don't want to have conversations that we shouldn't be having. Indeed. Outstanding. All right. So the doctor didn't specify. We can't tell what is the reason for the encounter. We can't tell where the treatment is being directed. So we're going to apply this guideline, and primary will be default, right? So we're going to eliminate A and D because they're sequencing secondary before the primary. Now let's go ahead and finish this out. All right. And D are done. Now look at B and C. What is the difference between the two? Well, B is sequencing this Z08 first. So let's take a look at this Z08, right? We know C50.919 is correct. It has to be there in both answers. And C79.51 is also correct for Correct, and here's why. Because this code is to be used for follow-up examination after completed treatments for malignant neoplasms. Okay, coders. We don't know, based upon this documentation, that the patient has completed her treatments. It just says that this is a 6-month review of her breast cancer treatments. They're reviewing it. And then at the end, it says that the oncologist adjusted her therapy regimen to include the secondary cancer. So they didn't say it was terminated. Looks like it's still going on to me. So Z08 should not be coded. You only use this when the cancer has been treated completely and it is completely eradicated from the body. So B, gotta go. And don't forget this guideline, that if it's not clear which cancer is being treated, primary should be sequenced first. So B gotta go, C is our answer. All right, coders. Now I'm going to pick up the pace a little bit. I was just a little slow just for on purpose. Now we're going to continue talking about Neoplasms guidelines, and there are guidelines specifically for anemia and dehydration and others when a patient has cancer. All right, so when the anemia is associated with the malignancy, guideline C2.C1, that means the malignancy may have caused the anemia. If the documentation supports that, you're going to sequence first the malignancy, your C code, followed by your anemia, D63 or D6 something, an anemia code. Next, when you have anemia associated with chemo or immunotherapy, it is not the same as anemia associated with malignancy, but the chemo, the treatment, C62C2. The encounter, when that encounter is only for the treatment of the anemia caused by the chemo, you're going to sequence that anemia first, followed by the malignancy, followed by the adverse effect. You're going to use an adverse effect code. We have another anemia code. When the radiation therapy, when that radiotherapy causes the anemia, C2C2. When the encounter is only for the anemia caused by radiotherapy, the other two were chemo and immunotherapy. This is different. The radiotherapy, you're going to code first your anemia code, followed by the malignancy, and then third, radiotherapy. Next guideline, hopefully you're following along in your MCG manual, and feel free to kind of make notes that speak to you. Now we're going to switch gears and we're going to dehydration, C2, C3. This is management of dehydration due to malignancy, right? So if this encounter is because the patient is dehydrated and only the dehydration is being treated, you're going to sequence first your dehydration, get a code from the dehydration category, and then second, your malignancy. Now, if the treatment is for complication resulting from a surgical procedure, surgical procedure C2, C4, you're going to sequence first your complication, whatever that complication is, Second, your T81.4, this is infection following a procedure if it's applicable. And third, your malignancy. And our last guideline that we're going to review, C2.D, primary malignancy that was previously excised. And if that primary malignancy was previously excised and if that cancer is completely eradicated, I think we need to specify that. Treatment for the secondary cancer with a history of cancer previously excised. Let's say someone had breast cancer and they no longer have cancer, then this is how you code. Okay, let me just elaborate a little more. If someone has breast cancer, and that breast cancer metastasized into some other part of the body, but that person had a mastectomy and the patient no longer has primary cancer, then you will sequence first your secondary cancer and second, personal history. Again, that cancer has to be completely eradicated before you can use this code, the Z85.3. So make sure your documentation supports that. All right. Now we've got a challenge. Yeah. I got one scenario, and then I'm going to hand it over to Mr. Sandeep, who's going to do his thing. All right, coders. Now, don't forget, this is how you solve a scenario. Make sure you highlight or inventory all of your diagnoses, signs, or symptoms. Identify your first listed code, and don't forget to apply all guidelines. Are you ready? All right, what is or are the correct ICD-10-CM codes for this encounter? A, D64.81, C79.81, and T45.1X5A. B, C50.929, D64.81, T45.1X5A. C, D64.81, C50.929, and D, D64.81, C50. The physician diagnoses the patient with anemia caused by the breast cancer. Chemotherapy treatment. The physician wrote the patient a prescription for iron tablets and administered a B12. Okay, coders, do your thing. This is where you can show what you've got, and I know you've got a lot. Your time begins now. Okay, coders, tell me, what guideline did you apply? Type in the chat, which guideline did you apply? You can say the number or you can say none. I want to know, did you apply a guideline? Good job. Good job. Those guidelines, they're going to help you every time. If you can identify the guideline, you can just kind of follow it. That's it. Just mimic it. All right, coders. Good deal. Outstanding. A lot of people said guideline. C2, C2, outstanding. So let's go ahead and highlight our keywords. We have male primary breast cancer, tiredness and fatigue, and the patient was diagnosed with anemia. The doctor said it would be treatment. All right. So here are my inventory: male primary breast cancer, tiredness, fatigue, anemia due to chemotherapy. I just wrote it. We might not need it. But my tip, don't forget to know the differences between these cancer as well as treatment. Treatment might not apply, but always be conscious of it. But it's not really applicable. If you just go grab this guideline, like many of you have, C2C2, go to the third column, it tells you how to sequence, right? So this C2C2 is the guideline for anemia associated with chemo. And you sequence your D30 or anemia related code. So it's one of those D codes, followed by the malignancy, followed by your adverse effects code T45.1X5. All right, so I'm looking over at my answers. Which one matches this? Okay, which one matches this sequencing order? Well, I can tell you off bat what doesn't match. B, because it's sequencing the cancer first. And C is not coding for an adverse effect code, so we can get rid of that too. All right, let's continue. All right, so we know that B is not sequencing correctly. It's sequencing the cancer, C50.929. Also, A is incorrect because it sequenced the wrong malignancy code. Look, coders, it's sequencing secondary cancer. This patient doesn't have any secondary cancer. You got to go 2. And C, you got your missing adverse effects code. And D, that's your answer. So let's do our due diligence. D64.8 category. This is other specified anemias. Go down to D64.81. Anemia due to anti-neoplastic chemotherapy. This is our code. And coders, look at this tap tip. If you put the sequencing you have to do when you take your exam is match the order. The anemia should be first, the malignancy should be second, and your adverse effect should be third. I'm going to let that marinate. Now I'm going to look at my, that was a quick marinate, right? All right, now I'm going to look at my malignant neoplasm of the breast of correct code, malignant neoplasm of unspecified site of unspecified male breast. And that's the answer. But we got one more code, this adverse effects, And you'll learn about adverse effects when we get to chapter, is this 19? Yeah, this chapter 19. I would also tap next to the adverse effects code. I would, because, and I would tap the sequencing order next to the adverse effects code because right? Yeah. I think it's a quickie. I think it's a good tip. I do. I do. All right. I'm breaking up again. Okay. Well, in good time. It says my mic is even getting worse. This is a brand new mic. All right, Mr. Sandeep, take it away, please, and thank you.
Thank you, Mrs. J.
Thanks for tuning in, and until next time, happy coding!